Microbiology. Organism detection and differentiation using the gram stain. Gram stain procedure. 1. Slides prepared from clinical specimens or culture isolates. 2. The slide material should first be air-dried completely. The slides should then be fixed, making the samples adhere to the slide so they are not easily washed off during the staining process. Fixing slides can be accomplished in one of two ways. 1. Heat fixation. After air drying, the slide can be placed on an electric slide warmer, 60 degrees Celsius for 10 minutes, passed quickly 2 to 3 times through a flame. Held over a loop burner for 1 to 2 minutes to heat fix the specimen. Or to avoid distortion, do not overheat. 2. Methanol fixation. After air drying, overlay the slide with 95% methanol for 1 minute. The methanol is allowed to run off, and the slide is again air-dried before staining. Methanol fixation is often the preferred method since the morphology of the host cells remains intact to a greater extent than with heat fixation. The most common gram staining procedure is described in the table. Refer to your laboratory's procedure for the time required for each procedural step. When performing the staining procedure, decolorizing is the most crucial step affecting the outcome of the stained smear. Over and or under decolorizing may lead to erroneous results. Step 1. Reagent/action, flood smear with crystal violet. Time, 30 seconds to 1 minute. Function, primary stain, all bacteria and most fungi, especially yeast, will take up this stain. Appearance of gram-positive bacteria, purple. Appearance of gram-negative bacteria, purple. Step 2. Reagent/action, wash gently with tap water. Time, 2 seconds. Function, rinse, tap water should be applied using an indirect stream. Step 3. Reagent/action, flood smear with grams iodine. Time, 30 seconds to 1 minute. Function, mordant, chemically binds the crystal violet alkaline dye to the walls of the bacterial and fungal cells. Appearance of gram-positive bacteria, purple. Appearance of gram-negative bacteria, purple. Step 4. Reagent/action, wash gently with tap water. Time, 2 seconds. Function, rinse, tap water should be applied using an indirect stream. Step 5. Reagent/action, add decolorizer to the slide, allowing it to run off. Time. Until runoff becomes clear, typically, less than 15 seconds for a thinly prepared smear. Function, decolorizing agent, can be alcohol, acetone, or a combination of both, important to avoid over-decolorization. Appearance of gram-positive bacteria, purple. Appearance of gram-negative bacteria, clear, without color. Step 6. Reagent/action, wash gently with tap water. Time, until no more color is seen running off the slide. Function, rinse, tap water should be applied using an indirect stream. Step 7. Reagent/action, flood smear with safranine. Time, 30 seconds to 1 minute. Function, rinse, counterstain, stains the decolorized gram-negative bacteria. Appearance of gram-positive bacteria, purple. Appearance of gram-negative bacteria, red/pink. Step 8. Reagent/action, wash with tap water. Time. Until no more color is seen running off the slide. Function, rinse, tap water should be applied using an indirect stream. Step 9. Reagent/action, blot dry or air dry and examine under microscope. Function, blot dry using absorbent paper. Appearance of gram-positive bacteria, purple. Appearance of gram-negative bacteria, red/pink. Automated stainers can be used to perform the gram stain. The advantages of such systems include 1. Consistency of preparation and staining. 2. Hands-free work, allowing the scientist to perform other tasks while a number of gram-stained smears are prepared at one time. 3. May reduce cross-contamination. 4. Provide a quality control system internal to the instrument. 5. Provide for an inventory of the reagents. There are also some disadvantages to the use of an automated stainer, including 1. Often, smears can be prepared faster by an individual, especially when only 1 or 2 slides are needed. 2. The automated stainer may be more expensive. When a gram stain is read, whether prepared manually or with an automatic stainer, the slide should be scanned under low power to get an overall view of the material on the slide and the specimen adequacy. Then, once appropriate areas are visualized on low power, the slide should be examined using the oil immersion objective for the presence of cells and microorganisms. The low-power observation may give a better picture of the host cells and any possible artifacts since they may be too large on oil immersion. A right leg wound swab from the medical/surgical floor is received for a routine bacterial culture. Which of the following statements about preparing the gram stain smear for this sample is not true? Please select the single best answer. 1. Prepare the slide before inoculating the culture. 2. A rolling technique may be used to prepare the smear. 3. A saline solution may be used to prepare the smear. 4. The slide may be either heat fixed or methanol fixed prior to staining. The correct answer. Which of A right leg wound swab from the medical/surgical floor is received for a routine bacterial culture. Which of the following statements about preparing the gram stain smear for this sample is not true? Please select the single best answer. 1. Prepare the slide before inoculating the culture. 2. A rolling technique may be used to prepare the smear. 3. A saline solution may be used to prepare the smear. 4. The slide may be either heat fixed or methanol fixed prior to staining. The correct answer is: prepare the slide before inoculating the culture. The slide should not be prepared before inoculating the culture. Especially when only one swab is available, the culture medium must be inoculated before preparing the slide. The material may be applied by rolling the swab across a wide area of the clean glass slide. Alternatively, the swab may be placed in a tube with a small amount of saline. After mixing the contents of the tube well, a drop of material may be placed on a slide and onto solid media. The slide should be allowed to air dry and then fixed with either heat or methanol. Which of the following statements most accurately represents a principle of the gram stain? 1. The crystal violet iodine complexes in the peptidoglycan layer of gram-positive bacteria are not removed by the decolorizer. 2. Safranine acts as a mordant, chemically binding the crystal violet to the walls of bacterial and fungal cells. 3. Iodine acts as the counterstain, staining the decolorized gram-negative bacteria. 4. The crystal violet iodine complexes in the peptidoglycan layer of gram-negative bacteria are not removed by the decolorizer. The correct answer. The crystal violet iodine complexes in the peptidoglycan layer of gram-positive bacteria are not removed by the decolorizer. Crystal violet and iodine will form complexes in the thick peptidoglycan layer in the cell walls of gram-positive bacteria. These complexes are not washed out by the decolorizer, therefore, the cells will appear purple. Safranine, not iodine, acts as the counterstain, staining the decolorized gram-negative bacteria. Iodine, not safranine, acts as the mordant, which chemically binds the alkaline crystal violet to the walls of bacterial and fungal cells. Gram-negative bacteria have a thinner peptidoglycan layer and a lipid-rich outer membrane, which is more easily disrupted by the decolorizer reagent. The complexes are washed out in gram-negative bacteria, so the cells will take up the safranine and appear red in the final stain. A patient is growing gram-positive cocci in their wound and blood cultures. Which of the following is the least likely to demonstrate whether the organism is occurring in chains or clusters? 1. The primary gram stain performed on the wound specimen. 2. The gram stain performed on the blood culture bottle. 3. The gram stain performed on the growth from the blood agar plate of the wound culture. 4. The gram stain performed on the growth in the thioglycolate broth of the wound culture. The correct answers: 3. Gram stains prepared from solid media are less likely to demonstrate characteristic morphology and arrangement. The arrangement of the bacterial cells is often the most characteristic in the direct smear of the specimen itself. However, smears prepared from liquid media, e.g., blood culture broth, thioglycolate, will also demonstrate characteristic morphology and, in this case, allow the observer to distinguish between cocci in chains versus cocci in clusters. Which of the following scenarios demonstrates proper preparation of a wound specimen for a gram stain smear? Please select the single best answer. 1. Firmly squash the swab against a clean glass slide. Overlay the slide with 95% methanol for 1 minute. Allow the methanol to run off the slide and air dry completely. Proceed to staining. 2. Elute the swab in a small amount of saline in a sterile tube. Mix the contents of the tube well and place 1 drop of the fluid on the slide and air dry. Overlay the slide with 95% methanol for 30 seconds. Allow the methanol to run off the slide, then immediately proceed to staining. 3. Roll the swab across a clean glass slide and allow it to air dry. Place the slide on a slide warmer set to 60 degrees Celsius for 10 minutes. Proceed to staining. 4. Roll the swab across a clean glass slide and allow it to air dry. Place the slide on a slide warmer set to 60 degrees Celsius for 3 minutes. Proceed to staining. The correct answers: 3. Roll the swab across a clean glass slide and allow it to air dry. Place the slide on a slide warmer set to 60 degrees Celsius for 10 minutes and then proceed to staining. When preparing a smear from a swab specimen, a gentle rolling technique should be used. An alternative method is to elute the swab in saline and place a drop of the fluid on the slide. If using the methanol fixation method, the slide should be exposed to 95% methanol for 1 minute, 30 seconds is inadequate. And the slide should be allowed to air dry again before proceeding to the stain procedure. If using the heat fixation method, the slide should remain at 60 degrees Celsius for 10 minutes, 3 minutes is insufficient, to ensure adequate fixation. In a gram stain smear, which of the described procedures represents an appropriate process for assessing the quality and determining the best area to examine on the slide? Please select the single best answer. 1. Immediately after the last rinsing step, place the slide on the microscope stage and scan using the low-power objective. 2. After the last rinsing step, allow the smear to air dry. Place the slide on the microscope stage and examine using the oil immersion objective. 3. After the last rinsing step, gently blot the smear dry, place the slide on the microscope stage and scan using the low-power objective. 4. Immediately after the last rinsing step, place the slide on the microscope stage and examine using the oil immersion objective. The correct answers: 3. After the staining process is complete, the slide should be allowed to dry before examination. This can be accomplished by air drying or by gently blotting the slide dry with absorbent paper. All gram stains should be scanned on low power to assess the cellular types present, as this may help determine the adequacy of the specimen and determine the best portions of the smear to examine, areas with more polymorphonuclear leukocytes. After this initial assessment, switch to oil immersion and observe all bacterial and cellular morphotypes present. Troubleshooting problem gram stains. Problem: everything on slide appears blue/violet. Probable reason for problem: the slide was probably under decolorized, as shown in this image. Solution: repeat procedure on new slide to be sure that the decolorization step results in clear solution running off the slide. Problem: everything on slide appears red. Probable reason for problem: the slide was probably over-decolorized, as shown in this image. Solution: repeat procedure on new slide to be sure that the decolorization is stopped when no more blue is seen flowing off the slide. Troubleshooting problem gram stains. Problem: the material on the smear is too thick to read throughout most of the slide. Probable reason for problem: too much specimen was applied to the slide. Solution: prepare another slide, being careful to add less material and to spread it out over a delineated area on the slide. Consider making pull smears by squeezing specimen between two slides and then pulling them apart. Problem: there is nothing much on the slide even though the specimen seemed to be somewhat thick and viscous. Probable reason for problem: the specimen may have fallen off the slide during the staining and decolorization steps. Solution: be sure to heat fix or methanol fix the specimen onto the slide before beginning the staining process. Problem: bacteria that are seen on the slide are the wrong gram stain reaction, color, than would have been expected, e.g., cocci consistent with S. Pneumoniae in a sputum appear as red/pink gram-negative cocci in pairs. Probable reason for problem: 1. Over-decolorization, although you would expect to see no blue/violet on slide at all if this were the case. 2. Cells are old or non-viable, example if patient is on antibiotics. 3. It is not S. pneumoniae, perhaps it is a gram-negative coccus. Solution: 1. See solution above for over-decolorization. 2. Can repeat the stain and if still negative, find out if patient is on antibiotics. May also find that culture does not grow pathogen. 3. Culture may help determine if another organism is what was seen on gram stain. Troubleshooting problem gram stains. Problem: gram stain positive for possible pathogen, but cultures are negative. Probable reason for problem: 1. Organism is slow growing. 2. Routine media may not support growth of the organism. 3. Slide may have been misread. 4. Organism reported on gram stain may have been an artifact. 5. Organism may be non-viable, patient may be on antibiotics. 6. Different part of specimen may have been used to prepare gram stain versus that used for culture. Solution: 1. Can extend incubation time. 2. If more specimen available, can plate specialty media. 3. Reread the initial smear and amend report if findings differ from the initial report. 4. Same as 3. 5. Check with clinician about use of antibiotics. 6. If additional specimen is available, could prepare another gram stain just to confirm reason for discrepancy. Problem: organism grew in culture, but was not seen on direct gram smear. Probable reason for problem: 1. Most often due to low numbers of organisms in the specimen that are below limits of detection on gram stain. 2. Misreading of initial gram stain. 3. Staining was inappropriate and organisms were very faintly staining, if at all. 4. Selection of material for gram stain different from that used in culture. 5. Culture could be contaminated. Solution: slide should be remade and or reread and reports amended, if necessary. A quality plan developed in the microbiology laboratory must include all quality components. The bench microbiologists provided the following recommendations for the quality plan. Which recommendation is most appropriate for the quality plan? Please select the single best answer. 1. A standard operating procedure, SOP, should only be followed after a QC failure. 2. Gram stain reagent labels should not include lot numbers, as these change too frequently. 3. Quality control should be performed on the gram stain reagents with every smear performed. 4. A competency assessment should be performed on all personnel who perform and interpret gram stains. The correct answer: 4. A competency assessment should be performed on all personnel who perform and interpret gram stains. CLIA requires competency assessment of all personnel performing and interpreting gram stains to ensure that results are appropriate for each type of specimen and that they are able to accurately distinguish elements of bacteria, non-bacterial microbes, and artifacts. The gram stain procedures, SOPs, should clearly state what to do if QC fails. This includes repeating the gram stain with the failed reagents before they are used with patient specimens. If the reagents fail the second time, they should be discarded. Document all failures and the resolution. At a minimum, gram stain reagents should be labeled with the following: contents and concentration of the container, appropriate storage conditions, date prepared or purchased, date opened and put into operation, as well as the expiration date. Lot number, if appropriate. Gram stain reagents must be checked frequently against appropriate controls to ensure proper reactivity. QC should be tested on each new batch/lot number of stains for initial performance, and then performed at least weekly thereafter. However, individual laboratories may have more stringent requirements. When developing a quality control procedure, organisms that will exhibit both gram-positive and gram-negative staining characteristics should be included. Which organism combination will cover this requirement? Please select the single best answer. 1. Pseudomonas aeruginosa and Escherichia coli. 2. E. coli and Staphylococcus aureus. 3. Haemophilus influenza and Klebsiella pneumoniae. 4. S. aureus and Enterococcus faecalis. The correct answer, 2. E. coli and Staphylococcus aureus. QC slides prepared with suspensions of a colony of any of the following combinations of a gram-positive and gram-negative organism alone or together on one slide can be used. 1. E. coli and S. aureus. 2. Enterococcus species and E. coli, or any Enterobacteriaceae, such as K. pneumoniae or K. aerogenes. 3. Enterococcus species and P. aeruginosa. 4. S. aureus and P. aeruginosa. 5. Moraxella cataralis and S. aureus. 6. H. influenza and S. aureus. While working on the evening shift, a request for a stat gram stain is received. Realizing that the bottle of crystal violet is empty, a new batch/lot number of the gram stain reagent is located and opened. When should quality control, QC, be performed? Please select the single best answer. 1. QC is only run once per day, first thing in the morning on the first shift. Leave the stat and any other patient gram stains for the morning. 2. QC is only run once per week and it was done yesterday. QC does not need to be performed again this week. Proceed to perform the stat patient gram stain. 3. Perform QC before you leave. It is important to get the stat gram stain done first. 4. Perform QC after opening the new reagent and verify that it performs properly before reading any patient specimens. The correct answer, 4. Perform QC after opening the new reagent and verify that it performs properly before reading any patient specimens. QC must be performed on each new batch of prepared or each lot number of purchased reagents. This must occur in addition to routine weekly QC checks. The QC on any new reagents must occur before you stain any patient samples. Control slides serve as a QC mechanism for staining reagents and techniques. QC should be run whenever new reagents are put into use, regardless of when QC was previously run. The stat patient gram stain should be performed promptly so as not to delay patient treatment. QC should be run upon opening the new reagent. Do not perform/report a patient gram stain using a reagent that has not been tested against a control slide. The patient's gram stain, stat or routine, can absolutely not be performed prior to running QC. The gram stain reagents must be checked against appropriate controls to ensure proper reactivity. The minimal amount of time required to stain/read the QC slide will not delay the stat test request. Weekly quality control, QC, of the gram stain reagents currently in use is performed using a known gram-positive and gram-negative organism. When reading the QC slide, all organisms have stained gram-negative, pink to red. What should you do next after repeating the staining procedure with the reagents? Please select the single best answer. 1. Make sure the decolorization step is performed appropriately. If reagents are still within the expiration date and the organisms now stain correctly, proceed to use the reagents on patient samples. Document the findings. 2. If all organisms are still pink to red, continue to use the reagents for patient samples. Document the findings and assume you did something wrong in making the QC slides. 3. If reagents are still within the expiration date and the organisms still do not stain correctly, use the reagents for testing patient samples. Document the findings. 4. If the organisms are in control, stain correctly, and the reagents are still within the expiration date, discard the reagents just to be extra cautious. The correct answer: 1. Ensure the decolorization step is performed appropriately. If the reagents are still within the expiration date and the organisms now stain correctly, proceed to use them on patient samples. Document the findings. If the repeated gram stain procedure demonstrates the correct results, it is probably due to the fact that one of the steps, most often decolorization, was done inappropriately the first time. On the other hand, if the repeated procedure again demonstrates the incorrect results, the reagents cannot be used to test patient samples. Control slides serve as a QC mechanism for staining reagents and techniques. If the QC slides are not stained properly, the problem must be resolved before patient specimens are examined and reported. All QC results and any failures that occur must be documented. If QC fails 2 times, it would be best to discard these reagents and use new reagents, with QC performed on them before use on patient samples. The issue must be resolved, not merely assumed to be a problem with making the QC slide. Proceeding to test patient samples in this scenario is completely unacceptable and may lead to erroneous results. If the repeat QC slide stains properly using the reagents currently in use, they can continue to be used as long as the expiration date is good. There is no need to throw out good reagents inappropriately. Interpret and identify bacterial and non-bacterial elements on direct gram-stained smears to evaluate specimen quality when appropriate, provide preliminary identification of organisms, and guide culture workup. Evaluating the quality of respiratory samples. Sputum. When a sputum sample is submitted for aerobic culture, it should be scored prior to acceptance for culture. Scoring involves determining the number of squamous epithelial cells per low-power field, LPF. The recommended criteria for rejection of the sputum for culture are greater than 10 squamous epithelial cells/LPF, which indicates probable contamination with oral flora. The procedure for scoring a sputum specimen is as follows. 1. Homogenize the specimen as much as possible. 2. Apply a representative sample to the slide, spreading it or using the pulse smear method to obtain a thin layer. 3. Perform the gram stain. 4. Examine under low power. 5. Examine at least 20 LPFs. Once a specimen is determined to be acceptable, the gram stain is viewed using 1000x oil magnification to determine the presence of polymorphonuclear cells, PMNs, bacteria, fungi, and markers of a good quality lower respiratory tract specimen, such as mucus, alveolar macrophages, or elastin fibers. The image is an example of a gram-stained sputum on low power containing greater than 10 squamous epithelial cells/LPF. It should be rejected for culture because the results most likely indicate predominantly normal oropharyngeal flora. The lower image is an example of a good sputum specimen seen on a slide at low power. Many PMNs are seen with no squamous epithelial cells, or at least less than 10 per field. When a sputum specimen is rejected, the physician or other care provider should be notified to allow another specimen to be collected without delay if clinically indicated. The medical laboratory scientist should communicate that this specimen will not provide useful information about possible pathogens from the lower respiratory tract. Endotracheal and tracheal aspirates. Endotracheal (AT) and tracheal aspirates from adult patients should also be scored prior to accepting the specimen for culture. Scoring of these specimens begins with examination of at least 20 LPFs, looking for the presence of squamous epithelial cells. The laboratory should treat these specimens as sputum. ET aspirates are usually not scored for pediatric patients. Bronchoalveolar lavage, BAL, and other respiratory specimens collected via invasive techniques. Gram stains of transtracheal aspirates, bronchoalveolar lavage, BAL, lung aspirates, and lung tissue are not evaluated for contamination like sputums and ET aspirates are, since it is assumed that specimens collected with these invasive techniques are less likely to become contaminated with normal flora and should represent the site of infection, if present. However, gram stains should be performed on respiratory samples from BAL, lung tissue, and aspirates to provide a more rapid answer about the possible presence of specific pathogens. Having this information to correlate with culture results is also essential. Sputum gram stain findings. Bacteria found in gram stain. Gram-positive and gram-negative organisms with no predominant morphology. Common infections suggested. None. Normal respiratory flora without a recognizable pathogen. Sputum gram stain findings. Lancet-shaped, gram-positive cocci, GPC, in pairs. Common infections suggested. Pneumococcal pneumonia, caused by Streptococcus pneumoniae. Sputum gram stain findings. Bacteria found in gram stain. Gram-negative cocci, GNC, in pairs. Common infections suggested. Moraxella catarrhalis pneumonia. Sputum gram stain findings. GPC in clusters. Common infections suggested. Staphylococcus aureus pneumonia. Sputum gram stain findings. Bacteria found in gram stain. Many WBCs and no organisms seen, NOS. Common infections suggested. Atypical pneumonia, caused by Legionella, Mycoplasma, Chlamydia, or a virus. Pathogens commonly encountered on gram stains by site/specimen. Site/specimen. Abdominal and peritoneal fluid. Common aerobes. Gram-positive. Enterococcus species, gram-positive cocci in pairs and chains. Gram-negative. Escherichia coli, Klebsiella pneumoniae, and other Enterobacteriaceae, gram-negative rods. Common anaerobes. Gram-positive. Actinomyces species gram-positive cocci. Gram-negative. Bacteroids, gram-negative rods. Less common organisms and/or comments. Many different bacteria and/or yeast. Site/specimen. Blood cultures. Common aerobes. Gram-positive. 1. Staphylococcus species, gram-positive cocci, in clusters and tetrads, including S. aureus and coagulase-negative staphylococci, CNS. 2. Streptococcus or Enterococcus species, gram-positive cocci, in pairs and long chains, S. pneumoniae as GPC in lancet-shaped pairs. Gram-negative. Haemophilus species, pale pink GNCB. Pseudomonas and enteric organisms e.g., E. coli, Klebsiella, Enterobacter. Common anaerobes. Gram-positive. 1. Hutibacterium acnes, GPR. 2. Peptostreptococcus species, GPC. 3. Clostridium, GPR. Gram-negative. 1. Bacteroids, GNR. 2. Fusobacterium, GNR. Less common organisms and/or comments. Candida albicans and other yeasts. Site/specimen. Cerebrospinal fluid, CSF, via lumbar puncture. Common aerobes. Gram-positive. 1. Streptococcus species, GPC in pairs and long chains, S. pneumoniae, GPC in lancet-shaped pairs. 2. Staphylococcus species, GPC in clusters and tetrads. Gram-negative. 1. Neisseria meningitidis, GNDC. 2. Haemophilus influenza, pale GNCB. 3. Enterics, GNRs, including E. coli, neonatal, nosocomial, Citrobacter, neonates with meningoencephalitis. 4. P. aeruginosa, GNR. Post-trauma or in presence of foreign bodies. Common anaerobes. Gram-positive. Actinomyces species, GPR, as a result of a brain abscess. Gram-negative. Prevotella/Porphyromonas. GNRs, as a result of a brain abscess. Less common organisms and/or comments. Listeria monocytogenes, GPR, is a facultative anaerobe that can survive inside phagocytes. Usually found in neonates and immunosuppressed patients. Site/specimen. CSF via shunt. Common aerobes. Gram-positive. 1. CNS, GPC in tetrads and clusters. 2. Enterococcus species, GPC in pairs and long chains. Common anaerobes. Gram-positive. C. acnes, GPR. Less common organisms and/or comments. Candida species, post-surgical. Site/specimen. Dialysate. Common aerobes. Gram-positive. Staphylococcus species, GPC in tetrads and clusters, coagulase-negative staph, CNS, and S. aureus. Common anaerobes. Gram-positive. 1. C. acnes, GPR. 2. Peptostreptococcus species, GPC. Less common organisms and/or comments. Dialysates from a continuous ambulatory peritoneal dialysis, CAPD, patient. Site/specimen. Genital specimens. Common aerobes. Gram-positive. 1. Streptococcus group B, GPC in pairs and chains. 2. Staphylococcus aureus, GPC in clusters and tetrads. 3. Yeast, including C. albicans and C. glabrata, large ovals with budding forms and hyphae. Gram-negative. 1. Neisseria gonorrhoeae, intracellular GNDC. 2. Gardnerella species, small, gram-variable or GNCB. Common anaerobes. Not applicable. Less common organisms and/or comments. Haemophilus ducreyi, GNCB. Site/specimen. Joint fluid. Common aerobes. Gram-positive. 1. Staphylococcus, GPC in clusters and tetrads. 2. Streptococcus, GPC in pairs and chains. Gram-negative. 1. Neisseria, GNDC. 2. Haemophilus, pale pink gram-negative coccobacilli, GNCB. 3. Enteric GNRs, such as E. coli. Common anaerobes. Gram-positive. 1. C. acnes, GPR. Gram-negative. 1. Bacteroids, GNR. 2. Fusobacterium, GNR with pointed ends. Less common organisms and/or comments. Generally, only one morphotype is expected in sterile body sites. 1. Candida species. 2. Corynebacterium. 3. Other gram-negative bacilli. Lower respiratory tract. Common aerobes. Gram-positive. 1. Streptococcus, GPC, in pairs and chains, including S. pneumoniae, GPC in lancet-shaped pairs, and group B strep in neonates. 2. S. aureus, GPC in tetrads/clusters. 3. Listeria monocytogenes, GPRs, in neonates and immunocompromised adults. 4. Yeast, observed budding and/or with hyphae. Gram-negative. 1. E. coli and other Enterobacteriaceae, GNRs. 2. P. aeruginosa, GNR. 3. Stenotrophomonas maltophilia, GNR. 4. H. Influenza in children and adults with COPD, pale GNCB. 5. Moraxella catarrhalis and Neisseria meningitidis, GNDC. Common anaerobes. Gram-positive. 1. Actinomyces, GPR. 2. Peptostreptococcus, GPC. Gram-negative. 1. Prevotella and Porphyromonas, GNR. 2. Fusobacterium, GNR with pointed ends. Less common organisms and/or comments. 1. Legionella species, weakly staining GNRs. 2. Nocardia, weakly staining, frequently beaded, aerobic GPRs. 3. M. Tuberculosis. Fungi such as Aspergillus or Cryptococcus neoformans, in the image below. Site/specimen. Urine. Common aerobes. Gram-positive. 1. Streptococci and Enterococci species, GPC in pairs and long chains. 2. Staphylococci, GPC in tetrads and clusters, including S. saprophyticus. 3. Candida species and other yeasts, budding and with hyphae, typically gram-positive. Gram-negative. 1. Enterics, GNR, including E. coli, Klebsiella, and Proteus. 2. Enterobacter species. 3. P. aeruginosa, usually nosocomial. Common anaerobes. Rarely encountered. Less common organisms and/or comments. E. coli is the most common cause of uncomplicated community-acquired urinary tract infections, UTIs. Site/specimen. Wound/abscess. Common aerobes. Gram-positive. 1. Staphylococci, including S. aureus, GPC in tetrads and clusters. 2. Streptococci, including group A Streptococcus, GPC in pairs and long chains. Gram-negative. 1. P. aeruginosa and enterics, such as E. coli, GNRs. 2. Pasteurella multicida, small, GNCB, seen with cat bites/scratches. Common anaerobes. Gram-positive. 1. Clostridium and P. acnes, GPRs. 2. Peptostreptococcus species, GPC. Gram-negative. 1. Bacteroids, GNR. Less common organisms and/or comments. 1. Bacillus anthracis. 2. Corynebacterium diphtheriae, gram-positive, club-shaped bacilli. More than one morphotype may be present. Stain results. All gram stains of clinical specimens should first be scanned at 100 times to get an overall view of the quality of the material and the relative presence/absence of white blood cells, epithelial cells, mucus, and debris. The slide should then be read and interpreted at 1000 times. Oil. There are indications that an infectious process is suggested by elements/structures seen on the gram stain. These same elements/structures may also help in determining the quality of the specimen that was submitted to the laboratory. In a sputum sample, the presence of squamous epithelial cells indicates contamination with oral flora. Whereas Kirschmann spirals, shown in the image, or Crayola bodies usually indicate lower respiratory tract secretions and would suggest quality sample collection. Indicators of pathology in a specimen. Some indicators of pathology in a specimen may include 1. The presence of white blood cells, WBCs, especially neutrophils. 2. The presence of alveolar macrophages in a respiratory tract specimen, especially bronchoalveolar lavage, BAL, or lung tissue, indicates a lower respiratory tract specimen and could also indicate phagocytosis of any bacteria. 3. Elastin or collagen fibers indicate cell necrosis and may suggest specific bacterial pathogens, such as Mycobacterium tuberculosis or Pseudomonas aeruginosa. 4. Intracellular bacteria or fungi suggest that the host is reacting to their presence and might suggest an infectious process rather than the mere presence of normal flora organisms. 5. Crystals in a specimen that contains bacteria might suggest that the patient is receiving an antibiotic or other pharmaceutical that has been aerosolized and given to the patient, or that it may have precipitated out in the specimen. Interpretation and quantitation of gram stain results. Bacteria and fungi, as well as host cells, can be quantified in the gram stain, and many laboratories may have their own methods. One such method is shown in the table below. No matter what method is utilized, it should be consistent throughout the laboratory by all personnel who read and interpret gram stains. The interpretation of the qualitative or quantitative statements should be shared with personnel who are receiving the gram stain reports from the laboratory. Keep in mind that in order to see a bacteria on the slide, the specimen would have to contain greater than 104 CFU/ml or gram of tissue. If there is a concentration procedure used before the smear is applied to the slide, this would change the meaning of the quantitation, and this information should be conveyed to clinicians as well. Quantitative approach 1. Rare interpretation less than 10 elements in total of all areas viewed. Few interpretation more than 10 elements in total fields viewed, but less than 1 element/field. Moderate interpretation more than 10 elements per field but less than 25 elements/field. Many interpretation more than 25 elements/field. Quantitative approach 2. +1 interpretation less than 10 elements in total of all areas viewed. +2 interpretation more than 10 elements in total fields viewed, but less than 1 element/field. +3 interpretation more than 10 elements per field but less than 25 elements/field. +4 interpretation more than 25 elements/field. The aerobic vial of a blood culture set flags as positive. Upon review of the slide, organisms are observed as shown in the image. What is the most likely identification of this organism? Please select the single best answer. 1. Escherichia coli. 2. Staphylococcus species. 3. Cutibacterium acnes. 4. Peptostreptococcus species. The correct answer is 2. Staphylococcus species. The image shows gram-positive cocci in clusters. Since this is the aerobic vial, it is most likely an aerobic organism, and Staphylococcus species are the most common gram-positive cocci in clusters observed in blood cultures. Escherichia coli would grow in the aerobic vial, but it is a gram-negative rod. Cutibacterium acnes is an anaerobic gram-positive rod that would not likely grow in the aerobic vial and is not consistent with the image. Peptostreptococcus species are anaerobic gram-positive cocci in pairs and chains, which would not likely grow in the aerobic vial and are not consistent with the image to the right. After reviewing 25 fields of a sputum sample submitted for a routine aerobic culture, you observe an average of 5 squamous epithelial cells, SECs, per high-power field, HPF. This leads to a determination that this sputum is acceptable for culture, according to the grading system, which allows up to 10 squamous epithelial cells per HPF as acceptable for culture. Which of the following describes what should have been done in this procedure? Please select the single best answer. 1. The squamous epithelial cells should have been scored on low power. 2. The grading system should have a cutoff of 5 squamous epithelial cells per HPF. 3. At least 50 fields should have been viewed. 4. Grading of sputum samples for routine aerobic cultures is not quantitative. The correct answer 1. The squamous epithelial cells should have been scored on low power. When a sputum sample is submitted for a routine aerobic culture, it should be scored prior to acceptance for culture. Scoring involves determining the number of squamous epithelial cells per low power field, LPF. The recommended criteria for rejection of the sputum for culture is a cutoff of greater than 10 squamous epithelial cells/LPF, which indicates probable contamination with normal oral flora. The procedure for scoring a sputum specimen is as follows. 1. Homogenize the specimen as much as possible. 2. Apply a representative sample to the slide, spreading it or using the pull smear method to obtain a thin layer. 3. Perform the gram stain. 4. Examine under low power. 5. Examine at least 20 LPFs. A gram stain is prepared from an operating room specimen obtained from a brain abscess, as shown in the image. How should this gram stain be reported and what is the most likely organism? Please select the single best answer. 1. Gram-positive rods, possible Corynebacterium species. 2. Gram-positive rods, possible Lactobacillus species. 3. Branching gram-positive rods, possible Nocardia species. 4. Gram-positive rods, possible Cutibacterium species. The correct answer 3. Branching gram-positive rods, possible Nocardia species. The branching morphology of this gram stain points to a member of the Actinomycetes family. This group includes Nocardia, Streptomyces, aerobic, and Actinomyces, anaerobic. The presentation of a delicately branching gram-positive rod is most typical of Nocardia species, especially when the staining is beaded, as in this case. The remaining choices are also gram-positive rods, but are primarily non-branching. A gram-stained smear from an unspun urine sample reveals 1+ polymorphonuclear, PMN, leukocytes and 2+ gram-positive cocci in pairs. Which culture result is most likely to correspond to this smear result? Please select the single best answer. 1. 10,000 CFU/ml coagulase negative staphylococci, CNS. 2. Less than 10,000 CFU/ml by gross appearance, alpha streptococci. 3. Greater than 100,000 CFU/ml gamma hemolytic streptococci resembling Enterococcus. 4. 15,000 CFU/ml by gross appearance, Lactobacillus. The correct answer 3. Greater than 100,000 CFU/ml gamma hemolytic streptococci resembling Enterococcus. When more than one organism per high-power field is visualized on a urine gram stain prepared from an unspun urine specimen, this usually indicates that a quantity of bacteria greater than 100,000 CFU/ml will be recovered from a culture, which indicates a clinically significant urinary tract infection, UTI. In this scenario, we have a single morphotype visualized in clinically significant amounts. Only one answer corresponded to the potential colony count of greater than 100,000 CFU/ml, with possible enterococci matching the gram stain morphology. Additionally, staphylococci would demonstrate gram-positive cocci in clusters and lactobacillus is a gram-positive rod. While reviewing the sputum gram stain from a patient who was admitted with a diagnosis of community-acquired pneumonia, the following is observed. What is the significance and likely identification of the organism you are observing? Please select the single best answer. 1. Organisms present may be a potential pathogen, such as Staphylococcus aureus. 2. Organisms present most likely reflect normal upper respiratory flora, such as viridans streptococci. 3. Organisms present may be a potential pathogen, such as Moraxella catarrhalis. 4. Organisms present may be a potential pathogen, such as Streptococcus pneumoniae. The correct answer 4. Organisms present may be a potential pathogen, such as Streptococcus pneumoniae. The bacterial cells are somewhat elongated, and a few have the tapered ends that fit the description of lancet-shaped. Streptococcus pneumoniae would be suspected as a potential pathogen. The cocci present in this gram stain occur in pairs and short chains, rather than clusters. Also, the cells are ovoid, rather than perfectly globose. This makes Staphylococcus an unlikely identification. Although the organisms present do look like streptococci, they are accompanied by polymorphonuclear, PMN, leukocytes. There are no epithelial cells present, making it less likely that they are occurring as normal flora, e.g., viridans streptococci. The organisms present are gram-positive, rather than gram-negative. Moraxella are gram-negative diplococci or gram-negative cocci in pairs.